The life-saving procedure of intubation through the trachea is extremely challenging. For an intubation, the endotracheal tube must first curve and slide over the epiglottis into the trachea. Otherwise, it slips straight into the esophagus and asphyxiates the baby and precipitates intraventricular hemorrhages. These unfortunate intubations through the esophagus occur upfront to 40% of all intubations. All intubations are performed with a laryngoscope, preferably a video laryngoscope, and a stiff wire stylet. And here we see the tube with the stiff stylet inside. The stylet stays in the tube and can occlude the tube during intubation so that the air coming from the lungs, which is an indicator for successful intubation, cannot be detected. When this happens, the stylet has to be carefully removed again without pulling the tube out, and all this takes time, during which the baby cannot breathe. A breakthrough endotracheal tube guide has been developed. This guide was studied in prematurely born babies. Its use consistently prevented the asphyxiating intubations of the esophagus. Here we see the new two-string guide. First, the guide is inserted into the tube, and then the middle finger goes through the pull string, and the endotracheal tube is held by the intubating person. And a pull lifts the tube and curves the tube to slide gently over the epiglottis into the trachea. Note that the tube stays open during intubation to detect air movements from the lungs, confirming a successful intubation. The guide also comes with an optional coupler that keeps the guide functional, and a T-piece to ventilate the infant can be connected to the guide. The T-piece is shown here with its pressure gauge omitted for better visibility. This new guide must become the standard for the intubation of babies.